are better models, there's better technology. It's not going to be without its challenges.
Governor Walz today unveiled his fraud fighting plan, which calls for a massive overhaul of the state's human services system. His plan would drastically change how Medicaid is administered in the state. Thanks for joining us at 5 on air and streaming on KARE 11 Plus. I'm Julie Nelson.
And I'm Lauren Lemanchak. Walz described the current system as a Frankenstein monster that you keep putting bolts on.
And while the governor says his proposal will modernize systems and prevent fraudsters from taking advantage of Minnesota programs, there's a lot of pushback from lawmakers, as one of the main tenets is to centralize power under DHS. Danny Spiewak leads us off live from the Capitol. Danny?
Well, Governor Walz is proposing a change that would basically alter the structure of human services and social services in Minnesota that's been in place for decades. But the idea is already facing opposition from the legislature and appears to have little, if not no chance of passing the session. Since the 1980s, Minnesota has administered Medicaid to most people through something known as managed care. Under this system, the state currently contracts with 8 insurers like Hennepin Health, Health Partners, and Blue Cross Blue Shield to provide Medicaid to those who are eligible, as Department of Human Services Inspector General James Clark explains.
Right, it's decentralized and complicated. We have 8 different managed care organizations with 8 different approaches to detecting and preventing fraud, and they're not necessarily sharing information with each other.
That's why Governor Walz says he's proposing an end to managed care through insurers in favor of a more centralized system in which the State Department of Human Services would run Medicaid benefits. He's also proposing that the state take over determining Medicaid eligibility rather than having the counties do it.
And what that does is takes the burden off the counties, the managed care organizations, and gives the state and the taxpayers a much more transparent view in how the system works.
The proposed structural changes appear to have caught legislative leaders by surprise. DFL Senator John Hoffman, the chair of the Human Services Committee, said he was disappointed to learn about this proposal just last night without a thorough conversation. Meanwhile, one of the top GOP budget negotiators called the proposal dead on arrival in the tied House.
It has no future, as far as I can tell, in the Minnesota State Legislature.
Representative Paul Torkelson, who co-chairs the House Ways and Means Committee, argues that insurers through the managed care system are better at catching fraud than the Department of Human Services.
And to put more responsibility on a state agency that acts irresponsibly, to me, is just at the very start a bad idea.
There does appear to be one area of agreement, at least, between Republicans and legislative leaders and the governor. They agree that they want to modernize the software that deals with Medicaid enrollees. And so they want to maybe pour tens of millions of dollars into that, would have to work together to pass a supplemental budget item this session or look at the budget next session, because it'll be a budget year next year. Back to you.
Well, Danny, I'm just wondering, did Senator Hoffman say what he wished they could have talked about? Is he concerned too about centralizing more power under DHS, which so obviously failed to catch fraud in the last 7 years? Or did he
His
not
statement
say?
didn't really mention what he was looking at. He didn't outright come out and say he was against the idea. He just said he had wished that he'd been part of that conversation, that it's a huge change. I think he just wants to have that discussion about what it could look like, but it's unclear what his stance is on this today.
And it seems like this was more about systems than people, but was there any mention about new leadership at DHS?
No, the governor has actually appointed Shireen Gandhi as the permanent head of DHS for at least the rest of his term. That'll be 10 more months. He's said he's confident in the job that she's doing right now, although Republicans in the legislature have pushed for confirmation hearings on that.
All right. Thank you, Danny. Well, KARE 11 has been covering the fraud crisis in our state for years. You can get a comprehensive look at our most recent coverage on KARE11.com/fraud.